Hi, everybody. Welcome. Welcome to this webinar. We are still waiting for a few people entering, but I think it's a good time to start. So please welcome our engineer, Diana Crognale. Diana Crognale is our educational manager. She's going to talk about the Smart Clinic software and do a specific training about the cervical spine mobility protocol. So Diana, the stage is yours. You can start.
Thank you very much, Marta, and welcome to all the attendees. Okay, let's start. So, neck pain is an extremely common disorder in the population, as you know. The percentage of people suffering from neck pain has always fluctuated between 15 and 40%. But recent studies have shown that this problem is reaching an incidence of between 50 and 60%. So the causes that lead to cervical spine disorders are multiple, such as sedentary lifestyle, incorrect postures, muscle contractures, or traumatic events, such as whiplash, for example. All these causes can generate pain and stiffness of the neck with a strong decrease in the movement ability. And from a clinical point of view, it's important to identify the cause by first evaluating the patient anamnesis and then using diagnostic investigation and objective clinical examination. You know very well that the starting point is the collection of all the patient information in order to have a clear medical history of the patient. In addition, the diagnostic imaging tests are fundamental to allow the doctor to have a better evaluation of the cervical spine disorder and its severity. Lastly, the objective clinical examination is mandatory because the clinician needs to quantify the active and passive mobility of the cervical spine during the head functional movement that you know are referred to the lateral bending, flexion extension, and rotation on the free body planes. The BTS cervical spine mobility protocol is part of the objective clinical examination of the patient and allows the quantitative assessment of the head range of motion in terms of angular excursion during the free functional movement, lateral bending on the frontal plane, flexion extension on the sagittal plane, and rotation on the transversal plane. As you saw in the previous webinar, here we find the new BTS SmartDX EVO technology for the three-dimensional kinematic evaluation of the movement. The infrared light cameras detect the movement of reflective markers placed on the patient on precise anatomical landmarkers, and then, via software, through the application of a precise biomechanical model, it's possible to obtain the kinematic information of the movement performed in terms of temporal parameters and joint angles. Now, let's watch the video that explains how to correctly apply the markers on the patient based on the cervical spine mobility protocol.
The cervical spine mobility protocol uses a very simple marker set. 6 markers must be positioned on the subject's body, 3 on the head and 3 on the trunk. On the head, 1 marker is placed on the nation, and other 2 markers on the right and left zygomatic processes of the frontal bone. On the trunk, 1 marker is placed on the suprasternal jugular notch, and other 2 markers on the right and left acromion. All markers must be positioned accurately in order to avoid incorrect reconstruction of head movements, which could lead to inaccurate results.
Okay. When the patient is ready, we can start the real acquisition with the BTS Smart System. This video is going to explain all the steps to do by using the Smart Clinic software interface. Okay, enjoy the video.
From the software interface, let's create the patient profile by clicking on New Patient and fill in all the mandatory fields, that is name, surname, birthday, and gender. Then click on Add Patient. Then let's create a session by clicking on New Session. Type the session name and select the pathology if needed. Let's select the protocol that you want to use for the acquisition, in this case, the cervical spine mobility protocol. Then click on Create Session. Inside the session, we can start to insert an acquisition trial by clicking on New Trial. From the list, Trial to Acquire, select the motor gesture to be acquired, and we suggest to start from the lateral bending, and then click on Acquire. Select the devices needed to acquire the trial, in this case, the infrared cameras for kinematic analysis. Click on Monitor to activate the cameras. For a correct trial execution, the subject is asked to sit comfortably on a chair with lumbar support and keep both feet on the ground with flexed knees at approximately 90-degree angle. The hands are placed on the thighs. The subject has to perform the 3 different tasks, starting from a neutral position that must be held for at least 3 seconds before starting the movement. When the subject is ready, click on Acquisition to start the acquisition. We are acquiring the first movement, that is the lateral bending. The subject has to perform the movement at natural speed, reaching the maximum angular excursion on the right and left side without forcing the extreme position. At the end of the trial, click again on the Acquisition button to stop the trial and then save the trial. You can add notes if necessary. Then, let's acquire the second motor gesture, the flexion extension. Click on Acquire. Select again the cameras, click on Monitor, and then on Acquisition button to start the flexion extension trial acquisition. The task can be performed numerous times in a single acquisition based on the clinical request. At the end of the trial, stop the acquisition and save. Lastly, select the third movement, that is the head rotation. Click one more time on Acquire, repeat the same steps shown before, and start the acquisition. For the rotation movement, in normal conditions, only the head must be rotated, avoiding any rotation movement of the trunk as a compensatory strategy. Stop the trial and save it.
At the end of the acquisition, we have to start the processing phase. First of all, it's necessary to apply the biomechanical model on our raw data, and a specific label will be assigned to each marker. Let's watch this other video that shows the tracking phase.
Once the trials are acquired, they need to be tracked to assign a label to each marker and reconstruct the movement. Select the session containing the acquired trials and double-click on the session to automatically move the trails in the Trials to be Tracked window. Then click on the button on the right to start the tracking. Using the model on the left as a reference, assign to each marker the corresponding label. To do so, click on a marker and assign the correct label. Once done, click on Save. Check that all the labels are assigned, and then click on OK. The procedure needs to be repeated for each movement. So assign again the labels to each marker and save the tracking.
Okay, now the trials are ready to be elaborated. So this new video will explain how to process the trials. During the elaboration, many mathematical functions will be used to extract all the clinical indexes, graphs, and parameters for the complete evaluation of the patient. The elaboration is completely automatic, and also the identification of all the necessary time events to describe the movement is done automatically by the software using automatic algorithms. The user has only to insert one time event manually for each movement and check if the automatic time event definition is correct. After the processing phase, the video will show also how to create the final clinical report. Okay, enjoy the video.
When the trials are tracked, they are ready to be processed, and after the tracking, they will automatically be transferred to the window called Trials to be Processed. The processing allows the definition of the temporal events that are needed to define the movement cycles inside each motor gesture. From the right, select the Cervical Mobility Protocol from the Calculation Protocol panel list and click on the button on the right to start the processing. Automatically, a window for the selection of the temporal events will appear. In the title of the graph, you can read the event to be defined. In the title of the window, you can read which trial the graph is referred to. First of all, for each movement, let's define the movement offset. So select any point before the beginning of the movement. Click on the chosen point, and then click on OK. Repeat the same for the other movements, lateral bending and rotation. Then, for each movement, let's take a look at the events that characterize the movement cycles. The events are represented by the orange vertical lines on the graphs, and they are automatically identified by the software using some algorithms, but it's important to check that they were correctly identified. In the automatic event window, look at the algorithm that is used to define the specific event, and follow the algorithm instruction to check if the events are correctly identified or if any event is missing. For example, the start of the flexion movement of each cycle corresponds to the point where the curve crosses the zero while going up. Check that this is done for each cycle, and if any event is missing, just define it by clicking on the point corresponding to the missing event, as done in this case. If an event is instead incorrectly identified, it needs to be manually removed, as in the case of the event of the start of the returning phase. The points to select, as the algorithm suggests, are the points of minimum on the curve. The last event is incorrectly placed, so to remove it, click on it with the right mouse button. Repeat the process until all the events are defined and checked. In this case, add the missing event. In this window, the automatic algorithm has to identify the local maximum, but there are two incorrect events. Let's remove them. Let's finish defining the time events for the rotation movement. Once all the time events have been defined, you can proceed to the end of the processing and save it by clicking on the Save button. Finally, the trials are now in the last window, and they are ready to be transferred to the final report. Let's select the report model and add the normality band for the comparison of the patient with the normal reference group. Select that one, consistent with the patient age. Click on the button to open the report. Immediately, the software shows the report preview, where you find one page with all the information for each movement performed. By clicking on the Printer button, it's possible to print the report or save it in PDF format by using the virtual printer.
Okay. Now, let's try to describe the content of the report in more detail. As you have just seen from the video, the report is created automatically by the software, and its reading is very easy and immediate. It contains the main kinematic information, has the temporal parameters and the range of motion relating to all the three motor tasks performed. In the first page, we find, of course, the patient details, and the next three pages are related to the three different movements, one page for each movement. The layout of the page is very similar, and all the information reported are the same for all the three movements. Now, let's take into account one page, for example, this one related to the lateral bending movement, and let's describe the content. In this area, the temporal parameters are reported, and in this other area, we find two graphs. The first one related to the joint angle normalized to the movement cycle, and the second one related to the relationship between joint angle and angular velocity. But first of all, we have to understand what is the lateral bending cycle. So the cycle starts from the neutral position of the head at 0%. Then the head moves on the right side, comes back to the neutral position, moves on the left side, and finally comes back to the neutral position. And here at 100%, the cycle is closed. So the cycle is divided in two main subphases, the right bending and the left bending. In this area on the top, we find the temporal information related to the entire cycle, the total time, how many cycles have been performed, and the range of motion. That is the total angular excursion from the extreme position of the head on one side to the opposite extreme position on the other side. Because many cycles have been performed, we report the maximum range of motion, the minimum values, and the average value. The same temporal information are reported also for the right bending. So in this case, when you read cycle, you have not to think to the entire lateral bending cycle, but only to the first subphase related to the head movement on the right side, starting from the neutral position, going down on the right, of course, and coming back to the neutral position. Here we find the duration of each phase and the corresponding angular velocity, considered as the speed with which the head is rotating around the axis of rotation of the movement. So the positive or negative sign is linked respectively to a clockwise or anti-clockwise rotation of the head with respect to the positive direction of the rotation axis of the XYZ reference system of the head. The lateral bending movement occurs around the Z axis, and the positive direction develops from the head towards the right side of the subject. Indeed, the value is positive during the right bending and negative during the returning phase to the neutral position because the rotation is anti-clockwise. Now, let me explain very quickly, one basic biomechanical concept that is surely useful for who wants to develop a new computation protocol. When you are interested to assess the range of motion in terms of angular excursion of the joint, you have to take into account the two contiguous bone segments that form the joint. And for each segment, you have to create a local reference system. To do that, it's necessary to apply 3 markers, at least on each segment, in order to create a local 3-dimensional reference system. For this reason, in this case, for the cervical spine mobility protocol, we have 3 markers on the head and 3 markers on the trunk, so that the 3 angles that describe the movement of the cervical spine joint in terms of flex extension, lateral bending, and rotation angles are calculated, considering the movement of the local reference system of the head in respect with the local reference system of the trunk. Okay, so what I have just explained for the right bending is exactly the same for the left bending. Now, let's describe this first graph that you have in the top corner of your report. On the horizontal axis, the percentage of the movement cycle is shown. And on the vertical axis, there is the angle value in degrees. As you can see here, all 3 movement components of the head are showing during the execution of one specific movement. The green line is relative to the lateral bending component. The flexion extension is blue, and the rotation component is pink. In theory, as we are evaluating the lateral bending movement, we expect the graph highlights only the variation of the green line because it's related to this movement. But the great advantage to perform a 3-dimensional analysis is to report on the same graph also the other two components that in case they are not zero, like in this case, they can highlight some compensatory strategy adopted by the patient. By convention, the positive or negative sign is associated with the execution of the movement in one direction rather than the opposite of the specific plane. For example, if we look at the pink line related to the rotation, the positive value identifies a rotation on the right, and the negative values identifies a rotation on the left. From the graph, we can deduce that this patient, while she is bending laterally on the right side, she's also rotating the head a little on the right. The same behavior is shown during the left bending, with a higher left rotation as compensatory strategy. Maybe this could be due to a muscle contracture or something else that don't allow a complete range of motion on the frontal plane, with the necessity of the patient to insert a compensation on the transversal plane in terms of rotation. Okay, these orange and blue dashed vertical lines show at which percent of the movement cycle the maximum angular extrusion has been reached, both in one direction and in the opposite one. The brown line instead shows the temporal event when the head returns to the neutral position. These horizontal gray lines identify the range. The range of angular excursion for the normal reference group with which the patient is compared, consistently with the age of the patient, like you saw in the video. If the patient doesn't manifest any motor limitation and doesn't feel pain in performing the movement, of course, the curve should arrive at least or exceed this limit of normal range. Okay, now the last graph shows how the angle reported on the vertical axis changes as a function of the angular velocity reported on the horizontal axis, cycle by cycle. There are so many ring curves because many cycles have been acquired, okay, during the acquisition phase. The graph must be read starting from the central point at which both the angle and the speed are zero, since the subject is still in the neutral position, of course. Pay attention that the shape of this graph can change depending on whether the movement is performed by stopping or not the head temporarily when passing from the neutral position. In this case, as the head stops when passing from the neutral position, the graph takes the form of the 8 number. And each time the angular speed will assume a void value, both in the neutral position and in correspondence with the points of maximum angular exclusion. The speed peak will be reached here in the central part of each phase. The increase or decrease of both angular velocity and angle values must be deduced considering the absolute value of the parameter. So pay attention, because the positive or negative sign is related if the rotation of the head, is taking place respectively clockwise or anti-clockwise in respect with the positive direction of the rotation axis. For this reason, you have to take into account only the absolute value of the parameter, angular velocity or bending angle. If the patient doesn't have motor limitations or doesn't feel pain, the curve should be specular, both with respect to the vertical axis and with respect to the horizontal axis, passing through the zero center. Okay, I think that that's all. And now, if you have some questions, please write by chat, and I try to give an answer to you.
Thank you, Diana, for the very nice presentation. In the meantime, I already answered a few questions, so you can write here in the box, and we will also answer online live. One of the question that is also here is asking if is the possible movement of the shoulder, raising the shoulder during the side movement of the head during the movement, calculated into the process, or should it be corrected during the acquisition?
No, generally, so the trunk must be still during the performance of the movement, because we are interested to evaluate the movement of the neck of this joint. So, as I explained, is the relative movement of the head in respect with the trunk. But if for any clinical reason the patient has this compensatory strategy and moves also the shoulder, we could assess also this behavior by watching the video, of course, in terms of observational analysis. But if we want also to quantify this compensatory strategy, we have to consider and quantify the three angles of the local reference system related to the trunk in respect with the reference system, absolute reference system of our laboratory. So it's possible to quantify also this movement of the shoulder, for example.
Thank you. Another question that and I already asked also in the box, was that yes, this protocol was specifically for the kinematic analysis, so just with the infrared cameras, but can be also upgraded with the possibility to add the EMGs. So
yes,
also with the possibility to also have the muscle activity during the same movement, during the same protocol. So
yes,
our system is nice because you can actually upgrade and choose the tools that you really want to have for your analysis, for your research questions, for example, in order to obtain the right data.
And Marta, in my opinion, it's very important to add also the muscle assessment, because as I have explained, so the kinematic values are the result of something that happens on our muscles. So we, through the kinematic, we measure the result. And but if we want to assess the cause, we have to evaluate also the muscle behavior.
Another one is asking, do you have specific starting positions for every movement? we want to test, or can we play with our imagination?
No, like we have explained during the first video, we suggest to take the patient, sit down on a chair in a comfortable position, okay, and the starting point is the neutral position of the head, so the anatomical position, okay. But if so, this neutral position defines the starting point. But if you need to assess something that now I cannot imagine, I don't know, maybe you can start from a different position. But the protocol suggests to do this starting from the neutral position of the head.
It also depends on the type of movement you want to
Yes.
If you
yes.
start, for example, if you do gait, you start with a standing position. If you do jumps, you start with a standing. So we have protocols that actually requires a specific position, starting point at least. But of course, based on also the gesture, especially in sports gestures, then you can also modify or adapt the type of movement and the start of the movement, but not
But pay attention that in terms of acquisition, you can acquire what you want. But in terms of processing phase, pay attention that what we have just showed during the video, so the elaboration is related to the functional movement of lateral bending, flex extension, and rotation. So because you have to take into account that also the elaboration is very close to the type of movement that you are performing. Okay, so if you change the acquisition, you have to take into account that maybe you have also to modify something in the processing phase.
So for now, no problem, thank you. So for now, we have no other questions. I just want to remind that our next webinar will be in June. Next June, it will be about the new jump protocols package. And it will be held by Matteo, our technician and customer care colleague. And please, if you want, we will also send you the new newsletter in a few days with the possibility to join and schedule and add it to your calendar this webinar. It will be June 4th at 2 p.m. just. So thank you very much for being with us. Thank you, Diana, for the nice presentation.
You're welcome. And thank you very much to all the attendees.
Thank you. Bye-bye.
Bye-bye.